Hi everybody, thank you so much for joining us today. My name's Callie, I'm part of the Compassionate Sheffield team and we have a programme behind the Sheffield Life, Loss and Death Festival. So we're here today for a session called Talking About Suicide, Awareness, Conversations and Support. And we're really grateful to be joined by Joanna Rutter, who's here to share her knowledge and her expertise with us, all around suicide awareness, prevention and support. So, Jo, are you okay just to move on to the next slide? Thank you. So while there's a few of us, a few people still joining us, there's just a couple of things that I wanted to just share with you all. First of all, if you'd like to see live captions, you can access those by clicking on the More option. So there should be 3 dots where you can click More. And then if you select Language and Speech, there's an option there to turn on live captions. Also, just a quick note around the content of today's session. So the session is all around suicide, awareness and support. We will be covering things around mental health and bereavement as well. And, you know, obviously this can be an emotional subject. So I guess I just want to acknowledge that and invite you to be mindful of how you feel sort of throughout today's session. If at any point it does feel a bit too emotional or if it's upsetting, please take care of yourself. If you need to sort of take a breather and step away for a moment, or if you need to leave the session, you know, that's absolutely okay. I'd also invite you, you know, if you feel like you need to have a little bit of time after the session, if you're able to, just a bit of space to look after yourself, really. And we will be recording today's session and sending everybody the slides and the recording as well, hopefully. So if it does at any point feel like you'd like to leave the session, you can always watch it back at a future date instead. So yeah, just to be mindful of that and to take care of yourself. We're also having a part of today's session at the end where Joanna's going to answer any questions that you might have. So we really want to invite you and encourage you to ask any questions that come up for you throughout the session. You're very welcome to ask a question from now throughout the rest of the session. You don't need to wait till the end. And to do that, you just need to select the Q&A function and pop your question in there. And then I'll be asking Joanna the questions at the end. And I'd invite you as well to ask questions that might feel difficult to ask as well, because there's always a really good chance that if you have that question, somebody else might do too, and might be really grateful that you've asked that question. Towards the end as well, I'm also going to ask you if you could, after today's session, share a little bit of feedback with us as well. The feedback will be completely anonymous, and it's a really helpful way for us to learn, you know, if this session's been helpful, so that we can hopefully learn and deliver more sessions in the future as well, and just improve from any feedback that you can share with us. We will be sharing some signposting information at the end. So today's session isn't really about sort of giving advice or sort of any sort of individual support. But if you are interested in accessing any signposting for learning more or sending people any information about support, we'll be sharing those links with you at the end and also in our follow-up email as well. So I'm going to hand over to Joanna now to get started.
That's great. Thanks so much, Callie. I really appreciate it. And just to say thank you again as well for the invitation to speak as part of the festival. I really hope this session is useful for people. Just by way of a bit of introduction, my name's Joanna Rutter. And I'm a health improvement principal working at Sheffield City Council. And as part of my role, I work around public mental health generally, but as part of that, I look after the city's suicide prevention plan. And I also do some work around bereavement as well. And I'm also hoping to develop a doctorate a doctoral proposal around this topic as well. So it's something that I've been working on for a few years now, and hope, like I say, hopefully you'll find this useful. So there's just a little bit of an overview on this slide, really, of what we're hoping to cover. What we're really hoping is that this session is a bit of a space, really, to sort of gently explore the topic of suicide. And I know that that's something that can feel quite overwhelming for people. It's quite scary, and it can be quite taboo to talk about as well. I think a lot of us worry about saying the wrong thing or not knowing how to help somebody who might be struggling. And I think that fear can sometimes stop us from reaching out to somebody. And we're really hoping that, this session will give people a little bit of confidence, really. So this isn't, like I say, it's not formal training. It's not about sort of crisis support, that kinds of thing. We're going to briefly touch on some key facts around suicide, and I'm very, very briefly just going to touch on the National Suicide Prevention Strategy and how that guides what we do. But very much the focus of this morning is about really trying to understand why it can be so hard to talk about suicide, how stigma plays into this as well, and how that can stop us from reaching out to somebody who might be struggling, or reaching out to someone who might be grieving a loss, who might be bereaved by suicide. So what I'm hoping is that you'll leave today's session hopefully with a greater awareness about the topic, and also feel hopefully a little bit of reassurance that it's okay to talk about suicide, and to leave you with some practical tools and resources that hopefully you can turn to afterwards and have a look at. And hopefully those resources might make it a little bit easier to have those important conversations and make them a little bit more possible for you. Okay, so we'll get cracking. I only really want to touch on some key facts about suicide. And I know when I first started working in this area, I was quite surprised by some of the headline data around suicide. And I just want to highlight a couple of things here that you may already know. Obviously, I can't see you. I don't know what your backgrounds are, but some of this might be new information for you. But sadly, more than 700,000 people die by suicide across the world every year. And over 6,000 of those deaths are here in the UK. And what's something that certainly surprised me was that 1 in 5 of us will probably experience thoughts of suicide at some point in our lives. It's about 20% of people. And of those, 1 in 15 will potentially attempt to take their own life as well. And those really kind of surprised me, certainly when I first started working in this area. But underneath that, as well as some common risk factors, and there are some certainly professionally we would call them trends around suicide, but some common risk factors that we see underneath some of that data. And so this slide highlights some of those more common risk factors that can increase someone's vulnerability to suicidal thoughts or behaviour. But it's really important to say that not everyone who experiences these things will feel suicidal. But these factors can certainly raise that risk for people. And just to go through a few of these, in terms of life events, we know that going through difficult life experiences, especially in childhood, so things like trauma, abuse or neglect, they can have really long-term effects on people's emotional well-being, as can major changes or loss. So things like the end of a relationship, losing a job, or the death of someone really close can be really overwhelming and make someone feel very isolated or hopeless. We touch on misusing drugs or alcohol as well, can affect how we think or cope with stress, or how we control our emotions. And this might make our, a situation feel a little bit worse. We also know from research into people's thoughts around suicide that living alone or feeling disconnected can lead to feelings of loneliness, which we know are a major risk factor for suicide, as is existing mental health conditions. So conditions like depression, anxiety, or other mental health illnesses can play quite a big role. And especially if they're untreated, or if it means that someone finds it difficult to ask for help. In relation to self-harm, we know that people who self-harm aren't always suicidal, but it's certainly a sign that someone is struggling, and that can increase people's risk over time, especially. Things like social and financial stresses, so money worries, work-related stresses, employment, can all feel quite overwhelming and contribute to people having suicidal thoughts. And we can also see from when we look underneath some of the data that I've shown before, that some people are at a higher statistical risk as well. So think in particular around middle-aged men. Men make up about 75% of all suicide deaths, certainly in this country, and we certainly see that pattern across most of the Western world. So I've highlighted that really because sort of understanding some of these risk factors can help us really stay alert and stay compassionate to someone who might be struggling. And it also included it to kind of remind us that quite often suicide is the result of a build-up of factors like this. It's very rarely one single factor that leads someone to take their life. So understanding that there's quite a range of common risk factors is really important there. Okay, so just moving on, I only want to briefly highlight that there is the government published a national suicide prevention strategy that very much guides the work that we do in England around preventing suicide. You'll see from here that it highlights a number of priorities really that certainly guide work that we do locally. The strategy particularly directs officers such as myself to look at and develop local plans that particularly target high-risk groups. Some of them we've just talked about, but in this new strategy, there were some new high-risk groups that we hadn't seen before that has, kind of catalysed some additional work locally. This strategy for the first time saw autistic people included as a high-risk category, and also pregnant and new mums were included for the first time as well. So that's kind of high-risk groups. And then there's also some new direction in there as well, addressing common risk factors. So it particularly talks about things like gambling. There's a lot of new and emerging evidence around the role that gambling can play in relation to suicide. And it particularly picked up on the role that online safety and keeping people safe online has a really important role to play as well around preventing suicide. But I guess for me, the one that was particularly important in the new strategy and something that was particularly welcome for officers such as myself was this last one around making suicide everyone's responsibility. That kind of, for me, was really important in terms of setting the tone for all the work that we do, whether it's nationally or locally. And that priority really encourages everyone to think about how they might be able to get involved in suicide prevention efforts. And really, like I say, it kind of just set that tone for us really, that there's always something that we can all do around preventing suicide. And so this slide particularly just picks up, for me, one of the most important messages that I really want to kind of get across today, that suicide is not inevitable. Suicide prevention efforts at both national and local levels are very much built on this core principle that suicide can be prevented with the right support, intervention and compassion. We won't necessarily stop every suicide, that's not what it's talking about, but certainly if we can understand some of this, it can really set us on that kind of baseline principle really, but that we can prevent some of these deaths. Collectively, this aim is often described as the zero suicide approach or a zero suicide ambition. And that's totally all about kind of building systems and communities where suicide is not seen as inevitable, but as something that we can all act to prevent. So you'll certainly see that in Sheffield's local suicide prevention plan and lots of other plans across that local authorities leads on, that they're all built on that principle really of a zero suicide approach and a zero suicide ambition. Moving on from that, just have a little think about common myths and facts. Certainly in my work, I quite often get involved in delivering suicide prevention awareness sessions or little training sessions. And one of the things that I've found that many people, regardless of kind of their background, you know, whether that's professional background, volunteering, or just members of the public who come along on training, quite often will all share the same worries or misconceptions about suicide. So in this part of the session, I just wanted to kind of highlight some of those quite widely held myths about suicide, but also alongside that, I want to share what the kind of evidence and experts in this field tell us. And it's certainly not about judging people for holding these kind of myths. These myths exist, but this is hopefully a bit of a way of sort of gently challenging some of that assumptions and help build confidence about what we know and what we don't know about suicide. So I'm just going to make sure I click the right buttons. Okay, so quite a powerful myth that exists around suicide is that if we talk about it, we're going to give someone the idea. We're going to put the idea in someone's head. I hear that quite often in suicide prevention training. But actually what we know from research in this area is that actually asking directly about suicide can really protect people and actually provide some relief from the pressure and, you know, the overwhelming thoughts that someone might be having at that time. And that's a theme that we'll come back to later in the presentation, actually, when we have a look at Johnny's story, which will make more sense later on. A second myth that I wanted to include here, that suicide people want to die. But actually, what we know, what research has told us, and when we've talked to people who have experienced suicidal thoughts and ideation, is that actually people want their pain to end, not their life. It's a really important distinction. Another myth is that you actually have to be mentally ill to feel suicidal. But as we talked about in the initial slide for this presentation, actually 1 in 5 people will consider suicide at some point in their life, and not all are mentally ill or have a diagnosed mental health condition. And that's certainly something I see regularly when I look at when we try and learn from deaths that we see in the city, that actually 2/3 of the people who die by suicide aren't known to mental health services and certainly aren't under active treatment at the time of their death. So it's a really important myth to challenge there. People are just seeking attention. I think that's a really difficult one to hear, isn't it? But actually what we know is that people are calling out for help, and that we need to take that distress seriously and do everything that we can to respond to people. And the final one, actually, there's nothing you can do. If someone wants to take their life, there's nothing they can do about it. But as we've talked about, you know, we certainly, the work that I do and colleagues do is built on the principle that we can. And that actually there's a lot of work out there that talks about actually being present for people, listening, connecting people to support really can save lives. Some people may well always go on to take their life, but actually we need to start from that premise that suicide is preventable and that we can help. There are things that we can do. I've kept this one out a little bit separately because I wanted to give it a little bit more time. One of the most persistent, I think, and quite painful myths about suicide is the idea that it's a selfish act. And I think that belief comes from the real hurt and confusion that people who are bereaved by suicide can feel. And I think it's really important that we acknowledge that the impact of suicide on loved ones can be absolutely devastating. And it's human to try and make sense of the loss that people are feeling. But when we take a closer look at the experiences of people who have been suicidal, what research tells us is that we hear something very different, and that many people describe feeling like a burden to other people, and as though their loved ones would be better off if they weren't there. And it's that place of despair and distorted thinking where suicide can feel to them as if it's an act of relief or actually an act of care for those around them. But if we can acknowledge that and challenge this myth, it really matters, because if when we do that, that's going to help us move away from that kind of blame and more towards conversations that are more compassionate. And actually, when we can kind of challenge those kinds of myths, it makes it more likely that we're going to be able to create a space where people can feel safe and speak up and hopefully seek help, which is what this session's all about, really. I also wanted to just touch a little bit on suicide and stigma. Stigma can play a really powerful role in how we talk, or especially how we don't talk about suicide. Stigma can leave people feeling really ashamed or judged or afraid to admit that they're struggling. And for some, it can create a belief that asking for help is actually a weakness, or that talking about suicidal thoughts is going to scare others or lead to negative consequences. But that silence is really isolating for people. It stops people reaching out, but it can also can also prevent friends and family and communities from feeling confident enough to offer that support. So challenging this stigma starts with really honest and compassionate conversations. And when we make space for people to talk about suicide without feeling judged or dismissed, it sends a really powerful message that it's okay not to be okay and that help is available. So when we speak openly and normalise conversations about suicide, we reduce that stigma and we make it easier for someone else to find their voice and reach out to us. Excuse me, sorry, just take a quick drink. So we're really getting into that space now where about talking about suicide and how that's so important, really. So how can that help? How can talking help? We've just touched on this. Talking, conversations all about suicide can help reduce stigma, which encourages open conversations, helps people to reach out. Raising awareness helps to, like I say, normalise these conversations, raises our own awareness and our own knowledge about how we might be able to support people. These conversations can actually provide practical support as well. It can offer emotional support directly to the person who's struggling. And I just wanted to pick up on the one around influencing policy. That might seem like quite an unusual one to put in there, but I think that goes back to that whole thing about normalising conversations about this topic. When we lift that lid a little bit more and share a bit more openly, it can help us respond better and develop better suicide prevention initiatives. That final point really about open discussions about suicide, creating safer environments, that helps and contributes to prevention efforts all round, really. Cool. Right, I'm going to just very, very quickly stop sharing now so that Nick can hopefully load this video up for us. It's a video that I've taken and I've used before in suicide prevention training. It's a video all about Johnny, basically, and his experience of feeling some quite intense suicidal thoughts, but also his reflection and his experience of actually someone who he didn't know intervening in that moment for him, and his reflection about what that meant for him, and how powerful that was. And certainly for me, when I first saw this video and listened to Johnny, certainly I found it quite reassuring. like you say, we touched at the beginning about how difficult it can be to have conversations about this and how we might feel unsure or worried that we're going to make something worse. And I think actually listening to Johnny helped me really understand that actually getting into that space and feeling confident to get in that space with someone really can make an absolute difference to somebody in that moment. So hopefully this will share. It's about, I think it's 3 minutes long, but yeah, the video can jump sometimes, but the audio certainly is really quite powerful. So if you concentrate on the audio, and hopefully, fingers crossed, this will work. If it doesn't, we will share it as part of the slide deck and the updates after this meeting. Okay, Nick, do you want to give it a try?
I went to this bridge and I went onto the edge of the bridge, and I don't know how long I was on there for. My memory is quite sort of hazy of that day, but just kind of out of nowhere, this guy appeared and stood next to me and started talking to me. Yeah, that was the moment I changed my mind. And you know, he wanted me to come off the edge and to go back onto the pavement, and I did eventually. I felt safe with him. Yeah, I felt it was different to anyone else. I felt safe. Just in, you know, we hadn't been talking for that long, but I felt safe with this guy. I felt he understood me, and yeah, he understood me, and yeah, I guess I was looking for that sort of someone understanding, and just sort of yeah, accepting, and you know, this is how I'm feeling, and that's what he did. Yeah, you know, I still get difficult moments. I'm still suicidal at times, but I mean, I still find it hard. Yeah, I still find it hard when I'm suicidal to say those words. But it is such a relief. Why is it so hard to say those words? What helps me is when people are direct, you know, and just say. What doesn't help is when people sort of meander around it and kind of, you know, what you actually feeling, and it just
you have
like,
dark thoughts.
yeah, yeah. Just you know, do you feel suicidal? And not making it like, sometimes it's quite clinical, but just making it just, you know, are you feeling suicidal? And just, you know, if they're calm about it, and if they're sort of don't make it a big deal, then it's easy for you to then say, yeah, I am. And that's yeah, because they are so intense. When I'm suicidal, is I'll just say it, just get it out there, just get it off my chest, and it yeah, makes such a difference. It doesn't completely get rid of the thoughts and the feelings, but it stops the intensity of it, because you don't have to hold it all in. It's, you know, you share it with someone, you know, go and have that conversation. I mean, you don't realize the difference that could make.
I hope that video kind of brought to life what we've just been talking about having conversations. And I know it really struck me when I watched that it actually could make a difference, just that being there with someone, and you know, someone being able to say the words to someone and help them share that that load. So to pick up one final thing before we move on to thinking about how we might have conversations with someone who's bereaved, and just think about the importance of words and language when we're talking about suicide, because the language that we can use can either reinforce that stigma that we've talked about, or on the contrary, can also promote understanding for people. And I just really wanted to share this table that certainly I've used before, which highlights some really practical examples for us about what not to say, what to say, but also why that's really important. And just to highlight a couple of things there. So quite clearly it says there about trying to avoid in language like committed suicide or commit suicide. That kind of harps back to a time when suicide was a criminal offence. It's no longer a criminal offence. but that language seems to have hung on a little bit. So what I hopefully you will find useful as well here is, as well as not just telling you what not to do, there are some examples there about what to say and more appropriate language that we can all use, like I say, to reduce that stigma. So I'll leave you with that as well. And just finally, oh no. Before we leave the topic about having the conversations about suicide, I just really wanted to leave you with some resources as well. Obviously, I've only touched on this topic as part of this session, but I wanted to make sure that you could access some more information, really, if this is something that you'd like to have a look at. So there are national resources there from places like Rethink, from Mental Health UK, from Samaritans and Mind. There's a lot of guides out there, and a lot of them are really practical, step-by-step guides about how to basically support you having that sort of conversation with somebody. And then at the top there's just a few local resources as well. There's this website there that's hosted by Sheffield Flourish. I've worked really closely with them on developing that signposting resource. And as part of that, there's a Talking Saves Lives campaign toolkit that anybody can use. There's posters and cards on there. It's probably more aimed at other organisations in the city. But there's things like suggested social media posts as well that you might want to use as part of your own organisation or within your own setting. But please do have a look at them, because like I say, one of the main aims of today's session was to introduce some topics, but to really give you some signposting and resources to take away and have a look at. Okay, so in this next section of the presentation, I'm going to talk a little bit about how we can support someone who's been bereaved by suicide. And much of what I've included in the next couple of slides has been taken from this publication by Support After Suicide Partnership. Like I say, the link is in the slides just here, and I'd really encourage you to have a look at. I've only pulled out a couple of bits to share with you this morning, but that resource is quite wide-ranging and incredibly helpful, and something that certainly myself and colleagues use an awful lot who work in this area. So really, just to touch on this first topic about being bereaved by suicide. And the report shares with us and reflects that actually losing someone to suicide is quite often described as one of the most painful and isolating bereavements a person can face. So not only is there the shock of a sudden loss, but for all the reasons that we've talked about earlier, it can be a very complex sort of bereavement as well, and throw up an awful lot of issues for people, some of which I've included on here. There's a little bit of a summary. But again, this ongoing theme around stigma and what that means in relation to suicide. And that stigma doesn't just affect the person who's died, it can impact those who have been left behind as well. And this report particularly picks up on the fact that, or where people have reported, where friends and colleagues or family have even avoided the topic, or not been available for that person who's experienced that bereavement, not because they don't care, but because of that fear, again, about not knowing what to say or how to offer the support. And that really just creates additional barriers for the person who's been bereaved. Oh, excuse me, I do apologise. The report also reflects that bereaved individuals are more vulnerable as well. And that actually being bereaved by suicide increases your own risk of developing, going on to develop either mental health problems yourself, post-traumatic distress, depression, anxiety, things like that. But also people who are bereaved by suicide are actually at more risk themselves for suicidal thoughts in the future. as well. So basically, kind of trying to sort of acknowledge and understand these unique challenges that a death by suicide prevents is essential when we want to offer meaningful and compassionate support to someone who's been bereaved in this way. So whether we're acting as professionals or friends, members of a community, our openness and empathy to someone can make a real lasting difference. And the report goes on to pick up again some really practical tips about what we should do if we're wanting to support someone who's been bereaved by suicide. And I've just picked up a few there to share with you this morning. So being present and available, just being there, offering your support is crucial. Reaching out and letting people know that you're thinking about them. Acknowledging that loss, not avoiding the subject. It's absolutely better to say something than nothing at all. Going back to that thing about we mentioned previously about people feeling like others were avoiding them or not speaking openly about the loss that they've suffered. Thinking about offering practical help, which I'm sure a lot of us would do anyway, but things like help with daily tasks, chores and paperwork, giving people space, the time to space to feel whatever they want to feel. Importantly, sharing memories and talking about the person who's died is really comforting and helps to keep their memory alive for the person who's been bereaved. Excuse me. I just wanted to pick up on this one as well about media, which you might think, oh, that's a bit unusual that it's in there. But quite often there can be media interest when there's been a death by suicide, and quite often there can be reporting, whether it's in the online or paper press, particularly around the time of coroner's inquests as well. And I think helping someone to expect that and manage and navigate that is something that's perhaps a little bit more unique to someone who's been bereaved by suicide than you would expect by other deaths particularly. And then again, that final point about using respectful language, things like died by suicide, again, it challenges that stigma that we've already talked about. And then conversely, the report shares with us a few tips about what to avoid as well when we're trying to support someone who's been bereaved by suicide. So not speculating about reasons or looking for explanations for that suicide. As we talked about at the very beginning when we looked at risk factors, there's never one, just one thing that's driven someone to want to take their life. It oversimplifies a very complex set of circumstances. And so again, not pushing for details, respecting people's privacy, picking up on that point previously as well about not avoiding the person or the situation, and being available for people. And then the final one, again, not being negative or judgmental, avoiding negative comments and not presenting suicide as a positive choice. But like I say, I've only really touched on a tiny bit of what's contained within that wider report from the partnership, and I would really encourage you to have a look at it and have a read. As we did before, just to signpost you towards some resources for when you leave the session today. There's, again, Samaritans and Support After Suicide have a number of things that you can access. SOBS is Survivors of Bereavement by Suicide. They have peer support groups in all of the South Yorkshire local authority areas. There's 2 in Sheffield. They can be really helpful thing to signpost people towards. And also particularly thinking about how we talk to children and young people about suicide. There's a report, a resource called Walk With Us that was co-produced with Chili Pep, who, if you're not familiar with, they're a local organisation in Sheffield who work with children and young people. And I'd absolutely encourage you to have a look at that resource as well. And then also, I was kind of conscious that people might join the session this morning, not just from Sheffield, but perhaps from other areas of South Yorkshire. And there are other campaigns or signposting resources that it might be useful to have a look at. So I've tried to include a few of those as well there. So please do use these links. Before I finish speaking and Callie takes us into the Q&A session, I really just wanted to make you aware about this free training offer from the Zero Suicide Alliance. I've mentioned them a couple of times during this presentation, but basically they offer free online training for people around basic suicide awareness and prevention skills. It's absolutely aimed at anybody kind of age 16 plus, who wants to feel more confident about supporting someone who might be struggling. It goes into a lot more detail about kind of risk factors and warning signs. There's some coached scenarios within there around starting conversations, and there's reflections from people with lived experience as well. Obviously, I've included Johnny's story in our session this morning, but there's lots of other reflections there from people with lived experience. And again, there's some signposting stuff on there as well. It takes about half an hour. It's self-paced. You move through the course as your own time dictates, and there's a little certificate there that you can download. But I really would encourage you, if you don't take much else from this morning's session, if you want to go and complete that Zero Suicide Alliance training, it's really powerful, and I'd really encourage anyone to take a look.